report.
At Basira camp for displaced people, Zubaida Bibi cradles her son in her arms. Of 5 children, only 1 has escaped illness following the floods. 2 boys and a girl have skin infections, and the eldest daughter is showing signs of malaria.
My children and I have scabies. Good medical treatment should be provided for us.
Medical teams were sent to crowded camps and flooded villages as soon as the scale of the flood disaster became apparent. Doctors still hold clinics to try and give camp residents some treatment, but the problems are still widespread. Dr. Nabil Roshan is treating patients in the Basira camp.
There are all types of infection here from what I can see. The main reason is that there is still some flood water. There is no proper system for cleaning or sanitation, and now mosquitoes are breeding, and because of that malaria is spreading. In these days, dengue fever has also been spreading in the camp.
The UN says nearly 1 million cases of acute diarrhea have been recorded. There are also close to 400,000 suspected cases of malaria, and reported cases of skin disease and respiratory infections have topped 1.2 million cases each. Fatma Bibi has brought her children for treatment to Multan, the closest large city to a number of flood relief camps.
My children are suffering from small boils on their skin due to insect bites and dirty water. Our homes have been swept away. My children and I are in distress. The water is dirty and poisonous, and all my children are sick.
The World Health Organization says women in particular are facing acute health problems in camps for displaced people. New mothers and their babies are particularly vulnerable.
If there is no proper nutrition, it will affect the height and weight of the female, whatever, and the child as well. And there are a number of infectious diseases that need to be treated, like diarrhea, like acute respiratory infection, like vaccine preventable disease.
He cites lack of privacy in the overcrowded camps as a major problem.
They may not be able to have enough privacy to breastfeed their children. Again, coming back to the water sanitation condition, in overcrowded camps, there is very little chance to have adequate and good quality sanitation and hygiene.
The government has been criticized time and again for its slow and patchy response to the flood disaster, but authorities claim health intervention was widespread and prompt enough to prevent any massive wave of fatal disease.